Welcome to day 23 of our CPC exam 30-day prep series. I'm from KS Medical Coding Academy, and today's focus is on HCPCS Level 2, a crucial topic for your CPC exam. Let's dive in. What is HCPCS Level 2? HCPCS stands for the Healthcare Common Procedure Coding System. Level 2 of HCPCS includes national codes used to report non-physician services like supplies, ambulance rides, and durable medical equipment. These codes are maintained by CMS, not AMA, like CPT HCPCS Level 2 supplements the CPT coding system. Structure of HCPCS Level 2 codes. HCPCS Level 2 codes follow a simple structure. They begin with a letter from A to V, followed by 4 digits. For example, code A0428 refers to ambulance transport. Each letter corresponds to a category: A for ambulance, E for equipment, J for drugs, and so on. Categories of HCPCS Level 2. You'll see a variety of services and items coded in HCPCS Level 2. These include durable medical equipment like wheelchairs and walkers, ambulance services including transport and mileage, injectable drugs listed under J codes, medical supplies, prosthetics, orthotics, and even vision or hearing services. Also, G codes often represent screenings or preventive services not in CPT. HCPCS versus Captain, Level 1. Let's compare HCPCS Level 2 to CPT. Also called Level 1 CPT codes are 5-digit numeric codes for physician services and are maintained by the AMA. HCPCS Level 2 codes are alphanumeric and used for services or supplies not covered in CPT. Understanding this difference helps you know when to look beyond the CPT book in real-world billing and exam scenarios. Common HCPCS modifiers. Just like CPT, HCPCS uses modifiers to give more detail. RT and LT indicate right or left side. E1 through E4 identify specific eyelids. GA, GY, and GZ are important Medicare-related modifiers. They indicate when a service isn't covered or when a waiver of liability is involved. Make sure you review these before your exam. How to locate HCPCS codes. To find a HCPCS code, always begin with the alphabetical index in your book. Search by the main service or item, like oxygen or ambulance. Then go to the tabular section to verify the full code and description. Make sure to also check if a modifier is needed for full accuracy. Book navigation tips. Here are some exam time navigation tips. Use sticky notes or tabs to mark common categories, like J codes for drugs or E codes for equipment. Highlight frequently used modifiers. Practice looking up 5 random HCPCS codes per day to build speed. Being fast and accurate with your codebook is key during the CPC exam. Summary. To recap, HCPCS Level 2 codes cover services and supplies not found in CPT. They are maintained by CMS and follow an A-V letter code format. Know your common categories and modifiers. And most importantly, practice navigating your book. What's next? Coming up next in day 24, we'll cover modifier basics for both CPT and HCPCS. We'll go over common modifiers like 25, 59, RT, LT, GA, and more, with real exam-style examples. Don't forget to like, subscribe, and hit the bell icon for daily CPC prep videos. Welcome to day 24 of our CPC exam 30-day prep series. Today's lesson is all about modifiers, how they work, where to use them, and how to avoid common mistakes in both CPT and HCPCS coding. Let's get started. What are modifiers? Modifiers are two character codes, either numbers, letters, or a combination, that give extra detail about a procedure. They don't change the core meaning of the CPT or HCPCS code but explain circumstances like repeat procedures, multiple locations, or side of the body. Modifiers affect how payers interpret and reimburse the service. Types of modifiers. There are two major types of modifiers used on the CPC exam. CPT modifiers, usually numeric or alphanumeric. HCPCS modifiers, typically alphabetic or alphanumeric. Modifiers can be informational, like identifying the body part, or they can affect payment, such as multiple procedures done in one session. Common CPT modifiers, exam focus. Let's review the most commonly tested CPT modifiers. Modifier 25. Use when an EM service is provided on the same day as a minor procedure. Modifier 59. Shows that procedures are distinct and separate. Modifier 51. Multiple procedures performed in one session. Modifier 76 and 77. Repeat procedures by same or different providers. Modifier 78 and 79. Procedures during the postoperative period. Know when to apply these, it's a high-yield area in CPC exams. Common HCPCS modifiers. Now, some important HCPCS modifiers. RT and LT refer to the right and left side of the body. E1 to E4 are used for eyelid procedures. GA, GY, and GZ relate to Medicare coverage and liability. These appear in real-world billing and may show up on CPC test questions too. Modifier placement rules. Modifiers are always added to procedure codes, not diagnosis codes. If you're using multiple modifiers, there is a correct order. Generally, payment-affecting modifiers come before informational ones. Example: for a debridement on the right side, you'd write 11042 RT. Real-life coding example. Here's a real coding example. A patient visits for a checkup and also gets skin tags removed. Codes used: 99,213 for the EM visit, and 11,200 for skin tag removal. You must add modifier 25 to the EM visit to show it's separate from the procedure. So, you report 99,213 minus 25 and 11,200. Common modifier mistakes. Watch out for these common mistakes. Using modifier 59 instead of 51. Forgetting modifier 25 with minor procedures and EM on same day. Not applying modifier 78 or 79 properly during post-op period. Using RT or LT with procedures that aren't side-specific. Be cautious, these errors cost points on the CPC exam. CPC exam tips for modifiers. Here are some fast tips. Master modifiers 25 and 59. They appear in almost every mock exam. Be familiar with post-op modifiers like 78 and 79. Know which ones affect Medicare billing, like GA and GY. Practice with real-world coding examples to gain speed and clarity. Summary. To wrap up, modifiers are powerful tools that ensure accurate billing and documentation. CPT modifiers describe procedures, and HCPCS modifiers describe equipment or supplies. Use them with precision, based on documentation, laterality, and timing. Practice is the key. What's next? Join us in day 25, where we'll apply all these modifier rules with practice scenarios and CPC mock review questions. This is where you'll build confidence with real exam-style cases. Don't forget to like, subscribe, and hit the bell for your daily CPC exam prep. Welcome back to KS Medical Coding Academy. Today is day 25 of your 30-day CPC exam prep series. In this session, we'll do practical coding exercises on CPT and HCPCS modifiers and wrap up with a mini mock test to reinforce your learning. Session overview. In today's session, we'll start with a quick review of CPT and HCPCS modifiers, followed by hands-on coding practice scenarios where modifiers must be applied correctly. Next, we'll test your knowledge with a mini CPC-style mock quiz focused entirely on modifier use. By the end of this session, you'll feel more confident identifying and applying modifiers accurately, just like you'll need to do on the CPC exam. Case Scenario 1 Modifier 25. In this scenario, the patient visits the clinic for a routine evaluation, but during the same encounter, the physician also removes a wart. We have two codes here, 99,213 for the office visit and 17,110 for the wart removal procedure. Since the procedure has a 0 or 10-day global period, the EM service must be separately identifiable to be billed. To indicate that the EM service was significant and separately provided from the minor procedure, we add modifier 25 to the EM code. So, the correct coding would be 99,213 minus 25 and 17,110. Case Scenario 2 Modifier 59 vs 51. In this case, the provider performs two procedures during the same encounter, 11,721 for toenail debridement and 11,055 for paring of a foot callus. While both are minor procedures, they were done on different anatomical sites, nails and skin. To report them correctly, we use modifier 59 on the second procedure, 11,055, to show that the services were distinct and separately performed. We do not use modifier 51 here, even though multiple procedures were done, because modifier 59 better communicates the clinical situation and avoids bundling issues. So, the correct coding is 11,721 and 11,055 minus 59. Case Scenario 3 Modifier 78. In this scenario, a patient is taken back to the operating room during the global period of a previous surgery because of a related complication. The provider performs the same surgical procedure again to address this complication. In such cases, we append modifier 78 to the procedure code to report that this was an unplanned return to the operating room for a related issue. Modifier 78 helps ensure correct reimbursement during the global period without resetting the global days. So, the correct approach is to use the same surgical code as before, and append modifier 78. Case Scenario 4 HCPCS Modifier RT. In this scenario, the patient is provided with a right knee brace, which is a form of durable medical equipment, or DME. The appropriate code for a knee orthosis is L1810. Since the brace is for the right knee, we append the HCPCS modifier RT to indicate laterality. HCPCS modifiers like RT for right and LT for left are important for accurate claims processing and proper documentation of the side treated. So, the correct code here is L1810RT. Case Scenario 5 Modifier 79. In this case, the patient had a tonsillectomy last week, and is currently in the post-operative period of that procedure. Today, the patient comes in with a hand laceration that requires suturing. This new issue is completely unrelated to the previous surgery. The procedure code for simple repair of a superficial wound is 12,001. Since this new service is unrelated to the original surgery, we must use modifier 79 to indicate that it's a separate and unrelated procedure performed during the post-op period. This ensures proper reimbursement and prevents denial due to global period rules. So the correct code is 12,001-79.